Hello everyone, Dr. Danesh is here from Canada. As you know, the coronavirus COVID-19 is a pandemic disease right now from March 11th. In this video, I will show you how we could control the spread of this virus and which country has done the great job in controlling the spread of that virus. As you can see in this chart, which is from Worldometer, in March 13, we have 150,000 confirmed cases, and the number of cases is evolving from January 22nd. In the next slide, as you can see, there are different countries here with different confirmed cases and death rates. So take a look at the South Korea. In South Korea, the confirmed cases are 8,086 people as opposed to death rate of 72. And this is the best confirmed case to death rate in all countries all over the world. So how South Korea has been able to control the disease and to reach to the point that this ratio is 8,086 people as opposed to only 72 death rate. For example, if you take a look at Italy, there's 21,157 cases and the death rate is 1,441. Which if you do the calculation, you see the death rate is much higher than South Korea. So South Korea has done a great job. So we wanted to take a look at how South Korea has done this great job. But before that, I'm going to get into the real estimation of mortality rate in China. A couple days before, we had this study coming out in March 12 in Lancet Infectious Disease Journal, which is the prestigious journal in infectious disease. So in China, previously, we believed that the death rate was 3.6% and outside China was 1.5%. But the author here is talking about the 14 days incubation period. So we have to consider the 14 days incubation period in our calculations. So how we could calculate the right number? So when you have the numerator and the denominator. So numerator is the number of death in certain time, and the denominator is number of confirmed cases, right? No, it's not right. So the author believed that we have to consider the 14 days delay. So that's how we could calculate the number of the death rate correctly. And as you can see, a recent time delayed adjusted estimate indicates that mortality rate of COVID-19 could be as high as 20% or even more, which is the origin of the virus. And as you can see in this chart, we had more than 20% of mortality rate here in February 11 as opposed to March 1st, which then China has control the disease somehow, and the death rate is still more than 5%. But before it was even more than 20%, considering the fact that we need to calculate the 14 days delay. So why testing is important? Testing is crucial as it allows the infected person to avoid infecting other people. And it's very, very crucial to know how to test and to know if we do more testing, we're going to be able to identify more positive tested people. and it allows us to isolate those people. So testing is crucial to lower the rate of infection. When we do not know who is infected and who is not, everyone should be considered infected until otherwise is proven with the help of the testing. In this slide, you could see how South Korea, as opposed to United States CDC sample tested, for example, numbers are really different. South Korea has already tested 248,647 people, as opposed to United States. At the same time, they have done 13,624 people only, which is 18 times less than South Korea. So how South Korea has been able to achieve these numbers? So what they have done is that they have actually created this drive-through testing for COVID-19, which has been done in 3 stages, which is great because people who are sitting in their car and they're not in contact with other people get tested. And that's how you could see in this chart, which is a daily new confirmed cases of COVID-19 in South Korea. They have reached to a plateau of 200 people new confirmed cases in a day, which is a great number for this country. But what are the reasons that we're not able to have enough testing? First, some people who are infected with COVID-19 have mild symptoms and therefore do not go to get checked. But basically, every one of us has to be checked through the drive-through testing, and it's critical. And the second reason is that in many places, the capacity for COVID-19 testing is really low. So now what should be done? For sure, creating drive-through testing centers all over the country, in Canada and all over the world, is a must, and it could test as many people as possible. And as I mentioned before, we could self-isolate those people until they get symptomatic, and they could contact the public health to be able to get the proper treatment, or in some cases to be able to hospitalized in certain cases. So how we could control the spread of this virus is that the more testing we do, the more successful we are in controlling the spread of the disease, as South Korea has done before. I hope you enjoyed this video, and thanks for watching.